intensifies its efforts to eliminate all forms of gender-based violence by 2026. Challenges within the country's judicial and health systems have been identified as the primary obstacles impeding progress in combating this issue. And according to the Kenya Demographic Health Survey 2022 report, 47% of women in Kenya have encountered sexual and physical violence at least once in their lifetime, as Elizabeth Atino details.
In this confined space, a gathering of women bears the weight of deep and invisible scars inflicted by diverse forms of gender-based violence. While some may consider themselves fortunate to live and recount their harrowing tales, the enduring pain of delayed justice cuts even deeper into their hearts. Jackie Mutere, a survivor of sexual violation during the 2007 to 2008 post-election violence, now shares her 15-year journey navigating the corridors of justice, which regrettably has proven futile.
It was a very bad experience, and because of the violation, I ended up with having a baby because of that, and that's when I decided to have an initiative that supports specifically survivors who were violated and then conceived from the violation and have children from the violation.
For Mutere and her fellow survivors, some non-governmental organizations have provided a safe haven for the over 34% and 13% of women who have experienced physical and sexual violence, respectively.
We focus on self-agency because we believe that the survivor themselves should tell their own story, and we also believe in memorialization, that not a single story, a single woman's story, a single survivor's story should ever be lost.
Let us remember that behind every statistic, every case that comes before the courts, there's a human being, a life irrevocably altered.
Despite efforts by the judiciary to establish 12 sexual and gender-based violence courts, including Shanzu, Makadara and Kibra law courts, aimed at enhancing accessibility to justice for GBV survivors, stigma remains a formidable obstacle. Many shy away from seeking help due to societal perceptions.
The implementation of laws that penalize sexual violence and support survivors in the legal process is a testament to the government's commitment. It has created an environment where survivors can find justice and support for their mental health needs.
The government has been urged to amend the Mental Health Act of 2022 to make it more inclusive for GBV survivors who are in dire need of medical and counseling services.
There is need to establish a mental health council in reference to the provisions of the Mental Health Amendment Act.
Alarming statistics from the Kenya National Commission for Human Rights reveal that up to 25% of outpatients and 40% of inpatients in health facilities suffer from various mental health conditions. These grim figures underscore the urgent requirement for increased deployment of health personnel to handle GBV survivors with sensitivity and professionalism, given that the current psychiatrist to population ratio stands at 0.2 per 1,000. Elizabeth Atieno, TV 47.